Welcome everyone to today's webinar, Fireside Chat on Practical Applications and Adoption of Generative AI for the Revenue Cycle. On behalf of Becker's Healthcare, welcome and thank you for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. You will find a few engagement tools on your dashboard. Please check out our resources section and also make sure that you fill out our session survey. We will have one poll question during today's webinar. When we get to the poll, the question will pop up in your slides box and you can submit your answer directly on the screen. Thank you in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. At this time, it is my pleasure to introduce our presenters. First, we have Noel Jouar, who is the Vice President of Patient Financial Services at Stanford Healthcare. Focuses on fostering transformation in the revenue cycle through technology and automation, while helping staff grow and adapt to these progressive changes. Noel has spent more than 3 decades in the revenue cycle, technology, and process improvement methods. Throughout his career, he has held operational and strategic consulting, leadership, and solution architect roles at prominent organizations, including Stockamp and Associates, Accretive Health, the Trezito Group, nThrive, Cambia Health Solutions, and served hundreds of provider organizations from large not-for-profit health systems to academic medical centers. We also have Corey Costley, who is the Chief Product Officer at AKASA and has led multiple teams to build products and businesses in the healthcare space. He co-founded Avizia, an enterprise telemedicine company that was acquired by Amwell. At Amwell, he became Senior Vice President of Hospital Products, overseeing a multi-million-dollar product portfolio comprised of enterprise software, devices, and services to more than 70 of the largest health systems. Costley started his career as a software engineer and spent time developing business frameworks at McKinsey and driving product development for Cisco. He is also an advisor for several investment firms and companies in the healthcare technology and solutions space. He holds a bachelor's degree in management information systems from Brigham Young University and an MBA from the University of Michigan. Now, without further ado, I will turn it over to Noel and Corey to begin today's presentation.
Thanks so much, Cameron. Really appreciate the introductions. And Noel will get us started here with a little bit of background on Stanford Health, but I was just noticing, Noel, that I guess it's a uniform that I wear. I'm wearing the exact same colors and scheme in my headshot. So keeping things normal here. But yeah, we'll kick it over to you, Noel.
Sounds good. So Stanford Healthcare, some of you may have heard of Stanford Healthcare. We are a health system located in Northern California. We have a large academic medical center in Palo Alto, and also have a community hospital on the East Bay. We are a $7 billion net revenue organization, and we see about 1 million patients, or a little over 1 million patients a year. We have 434, we've done 434 life flight transports. We have 619 licensed beds. We do a significant amount of work into the community, including a significant amount of charity and free care for the greater Northern California population. And we have done a significant amount of investment in continuing to improve our technology and applying that technology in the revenue cycle. We are an Epic shop, and have continued to be really racking up a lot of trophies in the automation and financial performance, and now significant improvements in our denials space.
Thanks so much, Noel. Impressive work by you and the collective Stanford team. And just one item before we get started here, we wanted to just cover some of the learning objectives for the time, give you a sense for how we're planning on using the time. So from a learning objective standpoint, we want to make sure that we're setting kind of a foundation and baseline for generative AI and why revenue cycle needs it. Here, obviously, spent a lot of time hearing from Noel based on his amazing experience and skill set about the adoption of technology, both at Stanford as well as just in general at health systems, and his thoughts and experience related to that, and identify other key KPIs and considerations when implementing Gen AI. So we thought it would also be helpful to kind of start here, as Cameron teed up, with a little bit of a poll question. So if we can take a minute or so here to give folks a chance, and as Cameron called out, you can just select the answer, but we'd love to get a sense from you all on where you're at using Gen AI within revenue cycles. So we'll give you all a few seconds here to select your answers. Great. Looks like we've got critical mass there. Thank you all. And so now we'll jump over and just take a look at what's coming in. All right. Interesting. So not unlike your typical adoption curve, we're seeing probably a pretty good spread. And so some that are using, some that are piloting, good healthy chunk there, but quite a few that are exploring, not quite using yet, and still a little bit on the fence. Okay. Super helpful context for us as we move forward here. So what Noel and I thought would be helpful is spend just a little bit of time up front here talking about just Gen AI and setting a foundational understanding for what it is. We'll keep that pretty brief, but probably helpful for folks that are in these categories here around exploring or not quite using yet or not sure. We'll start with an example that Noel's going to share of Stanford using Gen AI today. Then I'll provide some additional information related to Gen AI. Again, keep that kind of just to a few minutes. And then we'll spend the majority of the time chatting through some key considerations and questions around the learning objectives. And then as Cameron teed up, leave some time here for QA. Great. So Noel, I'll kick it over to you here.
Yeah, so Stanford Healthcare has implemented a secure chat GPT tool that's available to all employees on the intranet. So it's open to everybody. And the reason why we did that is we wanted to make sure that it was secure and that it also was HIPAA safe. It was able to provide a significant amount of value for people to experiment and see how ChatGPT can help with potential business applications and still not have a potential risk. Governance is an important part we will talk about more. But this is an example that I just typed in that said, please draft a letter to the physicians that explains the difference between authorization and medical necessity denials, essentially just an email. And so our staff is able to use ChatGPT in a safe place. It's likely that you have employees that are using ChatGPT outside of a kind of firewalled environment to do some things, either personally and maybe professionally. And Stanford made a decision very early on to deploy a tool that we can use that is able to be safe. The other thing is that the models don't get trained necessarily on clinical information and those sorts of things, so that it's able to have some level of governance regarding the clinical application and some of the ethical as well as just appropriate use of the clinical data. Stanford has also used ChatGPT to generate, to interpret information for simple messages from patients through our My Health application, the inbox messages. And then in some cases, it's triaging those and being able to provide a drafted response to patients with that the physician can then review, edit, and then submit to the patient. So it allows to have a significant improvement in the overall employee or physician satisfaction, reduces physician burnout, because it takes a lot of the heavy lifting of a lot of the simpler requests and is able to actually help the physician craft that information and get to a much different level of scale. So ChatGPT has been used at Stanford, and we're continuing to find many applications for that as we continue to really experience how it can be applied and then actually start to integrate it into our health system and into our health systems and into Epic.
Thanks so much, Noel. Super interesting examples, and appreciate getting some of the thoughts on how Stanford's thinking about generative AI, which GPT is a version of that. So we'll get into more details and get some of Noel's additional context there on other places and how Stanford's thinking about Gen AI as we get into the Fireside chat part of it. But just to build a little bit of a base, so based on what Noel just showed you, he showed you a generative AI tool, GPT in this particular case. But just to step back a bit, artificial intelligence, to give some foundational understanding, is a computer system that's capable of doing things that normally a human or human intelligence would be required for. So, for example, visual pattern recognition, or speech recognition, translation. And generative AI, or Gen AI, is kind of a subset of artificial intelligence. And it uses model types called large language models, or LLMs. And what's super fascinating and powerful about these particular models is that they can understand context and also create outputs based on that context. So Noel showed you an example where it's language-based understanding. So humans can type in a question that they're looking for an answer for, and GPT, or the Gen AI behind it, using this large language model, is able to then generate human readable and understandable language-based context back that can be pretty powerful. So that hopefully is a helpful baseline understanding of Gen AI and LLMs and how they fit in. They're being used pretty prolifically in other industries. So in retail, for example, they're helping create customized experiences for folks coming onto retail sites. In the customer support industry, I think we've probably all had the experience of various levels of satisfaction of interacting with chats and Gen AI behind the scenes in that chat way. In travel and hospitality, they're able to create customized itineraries based on preferences, individual preferences, and things that a particular traveler would want to see optimized for. And in software engineering, some pretty amazing applications of being able to do no-code or low-code development of software applications by being able to type in a prompt, hey, I want an application that does this, and the Gen AI being able to generate something behind the scenes that does do it. So some exciting examples of traction this technology is already having in other industries. It is important, though, to keep some key considerations in mind with generative AI. Yes, it is very good at creating speed and efficiency and getting to a starter. So as Noel teed up, is for Stanford is adding a lot for physicians to be able to help them scale by giving them something to start with when they're trying to create documentation for patients or other things. My particular experience or interesting experience with this, last summer, I had 3 daughters get married last summer. And as part of all the preparation that went into that, there were father of the bride speeches that I had to write, and I used ChatGPT as a starter there. And was very helpful, saved me quite a bit of time, and I think helped make those things much more interesting than I could have otherwise done. One of the considerations with using Gen AI is hallucinations. Folks may have heard about these in the past, but Obviously, generative AI is understanding context and then producing results and very convincing results. And sometimes it is presenting things that aren't necessarily true or accurate, but they seem to be because of how well it speaks about them. And so these can be obviously very important to control for in healthcare applications. And generative AI tools can be very good at data analysis and deep dives. It is important, obviously, they're based on the quality of data. So it has a lot to do with what they're trained on and what they've seen, has a heavy impact on what they're able to then understand and produce. And they're evolving and improving rapidly. So they are frequently updating models behind the scenes, those that are doing it, the open AIs of the world and Facebooks of the world. And they're actually giving these models tests, standardized tests in all kinds of professions, but law and healthcare. And they're not only passing those exams, but their performance is rapidly evolving and improving. So lots of fun considerations with generative AI and things to keep in mind. Here at AKASA, we're really excited about some of the applications, in particular in revenue cycle, that we're able to use Gen AI for. So what you're seeing on the screen right now is just an example of how we're using it in the coding world. And on the right-hand side there, you can see these are codes that the generative AI tool has been able to review the patient record and underlying clinical documentation and recommend and suggest. And then in that spirit of avoiding hallucinations and improving and validating trust in the solution, for each of those codes, it's actually calling out a human readable justification that's generated by our generative AI technology. And it's showing supporting evidence, direct quotes to support that justification for that particular medical code. And in this example, the user can then select that direct evidence, and the middle view is then updating to show that document and that reference as part of kind of that proof point there. So great.
I think it's really important to note that it's reference that it really is key to be able to understand the referenceable component of that. So essentially, being able to dig in or drill into the footnote of where that information came from, and it could have come from multiple places, and it's synthesized, but being able to kind of pull that apart into different pieces. That's, I think, one of the challenges in some cases with hallucinations, is that there's been multiple data sources, and it's pulling things together and making it sound very convincing that it is truly the facts when it actually is not 1 + 1 = 2. And so it's really being able to ensure that you know how those pieces are put together and being able to drill into that.
Thanks, Noel. Appreciate the additional color there. Key call out. Okay, we're going to move into kind of the fireside chat here, which is the exciting part. And we're going to start by just talking through outlook and use of Gen AI. So Noel, I think could be really helpful if you wouldn't mind starting with sharing some thoughts on, where do you see Gen AI headed? Looking in your crystal ball, where is it headed? How will it be used by health systems, and in particular revenue cycle, now and in the future?
Thank you. I think there's many applications. So Gen AI is going to really be able to help with providing prescriptive action, or in some cases, being able to respond to specific inquiries from a payer or a patient. So I mentioned the example of an inbox coming in for a clinical message with an ask from a patient, and the physician being able to have a pre-drafted message that then can be edited and sent along. That's the key step, is that human in the middle, the human in the loop. I expect that that's going to happen in any of the interactive points that we have in revenue cycle. So that goes to denials. It goes to being able to interpret correspondence and be able to provide some sort of guidance on how to approach, say, an underpayment request or something of that nature. And then customer service. So we get a lot of messages into the customer service department regarding patient billing matters. In fact, it pales in comparison, the number of messages we receive is significantly more than the number of calls that we receive. And being able to respond to all of those is a huge lift. I see Gen AI being able to really help with that. The key is being able to get that model trained so that it is appropriate and actionable and specific and is relevant for the ask of the patient, and then being able to do that at scale. I also know that the same thing is going to happen on the payer side. So payers will start to will be using Gen AI and LLMs to scrub through the data to determine trends and issues of medical necessity or authorizations. It likely will be generating denial letters. And the question is whether those denial letters will have a review process or not. In some cases, there's been some concern about that already, and where a response from a payer to a provider is really based purely just on data and has not been clinically reviewed. And so really being able to determine what the clinical basis of that is and if there's some sort of exception and how that can be managed. So those, I think, are really good examples. And again, it's really being able to identify where you have interactive points with patients and payers. And in some cases, if it's drafting a letter, Gen AI can really help with that and help with it at a significant amount of scale.
Thanks so much, Noel. Really appreciate some of that perspective. And I think you've talked about this too. At the end of the day, one of the things health systems, or one of the primary things health systems are trying to do, is provide exceptional experience and service for patients. And so, as you called out, there are some of these opportunities that are directly related to those patient engagements, like between a provider and patient, and drafting patient notes or other things to be shared with them, educational materials. But then on the revenue cycle side as well, it's about those efficiencies and those opportunities there. I think as we called out earlier, one of the things that Gen AI does a really good job of, or can do a really good job of, is analyzing a lot of data. And there's a lot of data within healthcare, obviously, and it's important to get through those and help try to synthesize and key insights and key takeaways, so that whoever is engaging with that patient, whether it's on the clinical side of the house or in the operations revenue side of the house, that they can spend the majority of their time thinking through some of those more complex interactions and how to make the most of that experience and provide the best service possible.
I think one of the keys is being able to look at a lot of the data, is to provide the right level of focus and really look at defining the problem statement to be clear enough so that the data that's used is rich enough and specific. Especially if there's a lot of nuance, it's really critical to be able to ensure that you have the right scope and the right data behind that. And if you don't have that in some cases, or you do and it's hard to stitch all together, that's the key, is being able to get that all pulled together so the model can actually be effective.
Great point. Yeah, really appreciate that. Great. So let's move to kind of the next topic that we had. So wanted to tee up, hey, we have an emerging technology, Gen AI, and revenue cycle teams and others within the health system may already have some technology. And so how best to think about existing technology versus leveraging new technology, Gen AI, and some strategies and paradigms maybe to think through that based on your experience, Noel.
Yeah, so we are an Epic shop, so our system of record is going to be the Epic EHR, and doing all that having all that work done in Epic is a critical component. Again, that's back to that date to ensure that all the data is captured. And Epic is starting to implement some things related to generative AI and large language models and those sorts of things, and there's use cases that are starting to emerge. Yet there's a lot of other organizations that are really ahead of the curve on that, and has been very focused on delivering solutions. So I think it's really an important balance to determine how you want to implement the components of large language models, generative AI, within your overall EHR or your technology strategy. So IT is a strategic partner in solving solving the question or answering the question. And the question is probably going to be answered differently for every organization. I think one of the most important things that we'll be really evaluating at Stanford is, do we have the right amount of data, and do we have an appropriate use case to start? And then at that point say, it may not be something available in Epic, but we say a good example would be in customer service. We need to have call data and message data, because in some cases they are highly correlated. So how do you correlate that? How do you get to omni-channel, where you're actually saying that this patient called 3 times and had sent 5 messages, and they were some of them were related to the same thing, and some of them may not be, to be able to understand what really the context is. And then at that point, being able to use that data and then train a model to do that. And then the question really is, where is that located? So I think that the plugins for generative AI is really the most important thing. And Epic has the ability of using Fire, which is a industry standard, or a standard interface. And that's a key piece to be able to access clinical information and patient information, and then be able to expand on that.
Great points. No, really appreciate the call outs around the data and having access to it, and that it may live in different areas to create a fuller picture, as you called out. Patients may be coming in from multiple modalities, and how to create that seamless picture in the background really is about how best to bring that data all together. And obviously, the IT folks within the health systems are a key part of helping enable that. Really appreciate that call out. And I think the point on the standards-based, a way for tools like Gen AI to get access to that data, the standards-based push that's been going on in healthcare for a while now, which is great. But I think a lot of more advanced tools and approaches are available. But that FHIR standard in particular can be extremely valuable in being able to exchange that data in a more scalable way. A lot of IT teams, I think, are used to now having that be a key way that's happening. I think one of the health systems we're working with has shared that they are getting millions of FHIR calls a month and through those services. So definitely an important part. And I think in general, generative AI, in order for it to learn the most, needs kind of the underlying data. So in the medical coding example, it needs the clinical information, and then also needs the labeled data, or the output for that. So ultimately, here's the underlying clinical data and medical record, but then it also needs how it was ultimately coded at the end of the day. And bringing those two data sources together are what really create that power of it being able to learn, oh, when I see this in the underlying data, it is indicative of potentially this particular output, is important consideration.
I think the key thing to understand is that large language models and generative AI are really helpers. And so it's really being able to see how you can leverage that helper, and then determine how that gets baked back in, or how the information gets funneled back into your system of record. And in some cases, say a phone call from a patient, you may have call recordings that can have large language model analysis on it. Though all of that information is not in Epic. It's going to be in possibly just a voice recording somewhere that has to be listened to. And so being able to summarize that information to at least get the footnotes, versus having staff have to type all that stuff in, is really a huge opportunity. And then being able to say that footnote worked, Cliff Notes worked great and is accurate. And that ties into the rest of the interactions that a patient may have. And in some cases, they may ask a provider a clinic or a billing related question during their clinic visit or before a clinic visit, and being able to pull all that information together, be able to essentially funnel it to the right place. Those are huge opportunities. And really it's being able to determine how that gets captured and how it gets managed within your ecosystem now, and being able to really get your arms around that. And large language models and generative AI can really help be able to put a finer point on that and really highlight certain things for you to be able to use and then be able to bake that back into your business processes.
Yeah, great call out, Noel. And maybe just to follow that thread of thought into kind of our next discussion topic, we thought it could be helpful for to talk through for Noel to share some thoughts, high level thoughts on an article that came out a while back from Dr. Pearl at Stanford on just how ubiquitous Gen AI will be, and then talk through, to Noel's point, some of those key considerations, like how folks will be interacting with Gen AI, and some of the things like change management and other things, training, knowledge, learning, that may be important as part of the adoption and usage and getting the most out of these tools.
Yeah, so Dr. Pearl is a Stanford physician, and he generated or wrote an article around the use of generative AI in healthcare. And if you think about all of the notes, all of the information that needs to get transcribed, can generative AI and large language models capture that better and be able to summarize it in a way that is able to speed up the process that physicians do manually, and be able to take that information and then actually have a conversation with a patient and actually have the system help with guiding that conversation. I think the key there is that it will, a lot of the data, a lot of the information, say for lab results and those sorts of things, you kind of click through and you have to look at those separately, and then you click on maybe a little information icon and it gives you more information about that test result. To be able to have that summarized in a way that someone can just read and gives them a heads up display of how to interpret, say, a CBC that they received, and things that they should be considering, and possibly even provide recommended articles that have been through a governance process that the clinicians say these are the things that we'd want to push to patients, is a huge thing, because now that allows a patient to be really in the driver's seat, to be able to have to reduce the amount of work and effort on understanding all that information, because it has been summarized in a way that's just going to be a little bit, certainly, and could be a lot more digestible. And so now you're saying you're taking data and you're turning it into information. And the interesting thing is, Dr. Pearl said that that it's going to be just as much more important as the stethoscope. Another interesting thing about it is that the stethoscopes can be digital, and so now you could actually compare a physician listening to somebody's heart or their lungs, and be able to compare that over time to see if there's changes that would not be able to be captured. So it creates this level of precision and precision medicine that is going to really help improve detection, is going to help improve the engagement, and really allowing a patient to navigate the overall their own healthcare journey.
Yeah, great walkthrough, Noel. Really appreciate that, and some of the thoughts on how Gen AI, coupled with providers and with others, can make a big lasting difference. Noel, one of the things I've heard you talk through related to integrating generative AI tools into revenue cycle and other areas is, as folks are looking to use it, the importance of kind of that change management, that adoption in particular. You've teed this up in the past. I think it's a great way to frame it. That is, it's not just adoption, it's adaptation. And so how do you help empower that adaptation, getting someone used to generative AI and how it can help them day to day? Any thoughts to share on that adaptation piece?
I think it's key to help develop your staff mindset. As we have brought technology in, and I've personally experienced this, where we have some new technology and we're applying it to a business problem and it doesn't completely work. And it's really easy to say, well, it doesn't work, and so it's not going to be applicable. The difference with generative AI and large language models and those sorts of things is that it can learn. So it may not work today, but it will work tomorrow. And the key is really being able to have your staff learn how to coach and teach the model, and identify this was not correct, and this other piece is really more important. That is a key aspect that we're going to all have to look at our workforce and start to recognize that the folks that are doing line level work will also need to learn how to coach a coworker. Their coworker is going to be a computer, and work through that process and not be disenfranchised when it doesn't necessarily work, but be able to say, oh, it didn't work. We need to make sure that it does work. We need to put the guardrails around it, be able to raise the flag to say something is not completely right. This could potentially be a hallucination, or it's inferring things in an incorrect way. And this is what we need to do to make sure that we have it really doing the right decision making or inference for us to make decision making. And then really being able to dig in and say, oh, it's missing some really important data that we need to give it, and give the model and the machine for it to be able to learn, and then be able to identify how to get that. And if the data is dirty, to also be able to tell the machine and for us to know that the data is not necessarily the best, and how do we capture that better. And that could be humans capturing it better. It also could be telling a computer how to capture it better. All those things are different skills that we really need to work with our staff for them to develop and master.
Yeah, appreciate that, Noel, and really appreciate the framework paradigm you teed up there, which is around kind of this coaching model, this symbiosis between the tool, generative AI, and the staff member, whoever it is, and kind of using it. And some of these key considerations, I think sometimes we think that management track of working in that way is a different track, and you have individual contributors versus managers. But really, with Gen AI now, everyone is a manager in some way. They're a coach for this particular tool, and as you called out, it's really important that they, in addition to getting the work they need to get done, that they invest time in coaching that tool to make it for them to make it even more productive and valuable over time as well.
In the manufacturing industry, they've coined a term cobot. And so essentially robots are doing things as humans are working alongside them to make their work more safe, but they're essentially a co-worker. So we really need to think of this technology in exactly the same way, because what drives those cobots is essentially the same kind of thing that we're talking about here.
Great call out. And I think a key part of kind of any change management, obviously, is getting someone aware, familiar, and excited about it. And we found it helpful to get them some foundational training on what generative AI is, and have them try ChatGPT and other tools just to get those aha, fun, exciting moments themselves, like my father, the bride wedding speeches. So it can be an important part to kind of trigger that. Great.
I think it's going to, what really it's going to help with is being able to deliver a higher level of human interaction, our human interaction. So it's not a humanized response from AI, but our humans being able to interact with patients in their health issues or their billing issues, or for us to resolve a payment issue at a scale that's different. So, will jobs will change? Will jobs go away? I think we really need to understand and recognize that there's way more that we can do for being able to improve the patient outcomes, and being able to be more efficient and more effective, that will have impact. But it's really to ready our staff for that impact, so that they can use the tools to actually really dig and reach deeper into the AR, and be able to resolve issues at a scale that we, in many cases, were never able to touch.
Great call out. And back to that point you had made around the adaptation and working with Gen AI. Okay, moving to kind of our second to final fireside chat topic here. So we've talked a lot about generative AI, how exciting it is, some of the uses, the ubiquity of it in the future. I think Noel could be really helpful to get your thoughts on how to think about implementing Gen AI tools and some of the governance to be aware of and key performance indicators, both during and after the implementation of these tools.
Yeah, so I think the key with AI implementation is that the applications are so diverse and could have a huge impact. But really, governance is an important piece. So there's a data governance piece as far as what is shared, and is that shared outside of your own health system into a model that's being generated with computers that are not essentially in your own health system, in your own ecosystem, and being able to understand that data needs to be really heavily protected for HIPAA. We've talked about data breach. There's all the discussion and concern about data breaches that have happened recently, and that's going to continue to happen. And being able to ensure that you're bulletproofing that process. That doesn't mean that you should slow down. It just means that you should be aware and be able to make sure that you have a governance mechanism, and to recognize that AI may be implemented in multiple places from multiple vendors to solve specific problems, which is okay. But then having a group that essentially is monitoring those and starting to see adjacencies and maybe overlap to be much more efficient, and to also recognize that if the models are being trained possibly differently, should they start to overlap. And I think that's really a tricky thing, right? Because we can say, well, there's clinical information, and that's essentially the clinical component. There's the maybe billing information. But when we're talking about a medical necessity denial, where we're having maybe a generative AI letter, or a letter generated through AI, you're using clinical information to address also the aspect of the billing and the contracts and those sorts of things. And so knowing how the models are getting trained, asking those questions, asking what data set is used to train that model. Is it your own data? Is it generally available data like CMS data? Is it, is there other data that's being used out on payer websites and those sorts of things? Being able to recognize and be able to have a clear understanding of where those data points are, and have that documented. Because at some point, some of those models are going to be proprietary, and some of them are going to be also things that would be shareable. And recognizing that within the health data protection element, as well as the brand, our own brands, is also an important piece. And I think regarding KPIs, the KPIs are going to change. A good example would be, when we're talking about productivity for a staff member, and it's, how many accounts they're able to resolve. Well, if Gen AI is actually doing a lot of that work, maybe that KPI is actually not correct. So essentially, we're going to have to reimagine some of those KPIs, and large language models and machine learning and those sorts of things can do a significant amount of correlation that's really mind-boggling how many different data elements can all get integrated together and correlated that we cannot wrap our head around completely. Yet the data comes out and it can be tested and it can be validated that yes, these different data elements actually created an outcome predictor, and that outcome predictor actually turned out to be pretty accurate. And then being able to use that to say, okay, so now we know that outcome predictor is more accurate and is effective. How can we integrate that in? So if we have, say, a staff working on a much trickier, more difficult account, they're going to spend much more time on that. And then the question is, how do you measure that KPI for that performance and that outcome? And be not just a lagging indicator, because that outcome may not happen for many, many weeks. And how you're able to actually track that and ensure that the work that they're doing is actually the most effective. I think that's the most exciting piece of this, but it's going to require a lot more thought to essentially reevaluate how we are measuring our staff.
Yeah, fascinating. Great thoughts. And Noel, just teeing up a thought you shared, I thought it was it's an important call out that you made around, hey, it's okay to have multiple models and generative AI tools that are available, like any type of application. You get so much value out of a generally trained thing, but as you get to additional levels of specificity, you can see that performance in that particular area go up significantly. And we've seen that in our world, having a foundational model that understands healthcare and context, but then how much additional performance and value can be created by continuing to fine tune and refine that model or a portion of that model to perform specific tasks, whether it's coding or prior authorization document selection. That can be really important, and could mean that there are multiple models that are within the the broader solution set. Great. Well, we thought it could be helpful with to just share a few final advice thoughts with kind of Noel starting here before we get into the Q&A. And so yeah, Noel, I'll kick it over to you.
Yeah, so with really the key piece is to really identify the problem statement and be able to work on focusing in on really as narrow as possible to really make generative AI work for you and large language models to work well, because that data is going to have a higher level of refinement, and it's in many ways easier to kind of test. So being able to define that problem statement clearly. So for example, with the generative AI for the inbox messages, they really were able to triage those based on the categorization that patients had selected, or in some cases the model was inferring. And then they were solving the simple ones and not trying to get into all the other pieces and make recommendations of what maybe a physician needs to do for the more complex ones. That's just too much. So really starting small and applying it and adopting it, adapting the different your data, adapting your staff around that, adapting your processes, and then use that as the model to continue to expand, and it just continues to layer outward. I think the other thing is your staff are likely using ChatGPT now. You personally are maybe using ChatGPT now, and recognize that you need to really bring that into your own ecosystem and figure out how you can start using ChatGPT within your organization that's safe. And do that now, because what's happening is ChatGPT is being used in industry, and it's being used in the payers everywhere, and it will affect our bottom line. Because if we're not able to figure out how we can operate at scale, the organizations that are going to start to win more. And we need to recognize that we have an opportunity to really be able to get much more efficient and much more effective. That also means defining how our staff are going to interact with our patients and the payers, and make that much better than maybe what we're doing right now. And then again, I mentioned it earlier, is that just reconsider your KPIs and your measurement methodologies. If we're looking at, the accounts that people are working and we're focusing in on kind of productivity or production, that it may be different. We're really looking at how we're going to measure overall impact. And if many of the easy buttons are taken away because the systems are able to handle that with interoperability and with generative AI responses that are almost autonomous, then at that point you need to recognize how you're measuring your staff and rewarding your staff, and for that matter, really even before that, is developing your staff.
Yeah, thanks, Noel. And I'll just add, I think one of my recommendations is to adopt solutions, not just technology. And so, a couple areas maybe to think about this. The first is on the technology piece of whatever the solution is. Shouldn't just be the generative AI. It should help actually deliver at the end of the day the value. And so, It's not just about, hey, can I search up a question about a particular patient, but hey, can that actually be incorporated into the patient education materials and help with the workflow? And so on the revenue cycle side, maybe with the prior authorization, not just suggest the documents, but also help submit those and track those outputs for peer-to-peer reviews or reporting or other reasons. And then in addition to the technology, the services can be extremely important as well. That would include the implementation and the training and the support services wrapped around the solution to really help staff and others incorporate and get the most from the tools. Great. Well, with that, we'll move into our Q&A, and I believe, Cameron, some questions have come in that you can help us walk through.
Yeah, definitely. First, just want to thank you two for that great presentation. Like Corey said, we're going to transition into the Q&A portion of the webinar, the last 10-ish minutes. For the attendees, please feel free to enter any additional questions into the Q&A box on your screen. And if we're not able to address your question in the remaining time, we're definitely happy to follow up with you offline with your question. So the first question is directed for Noel. You mentioned Gen AI use cases as interpreting correspondence, billing messages, etc. To what extent are you developing these solutions yourself and with Stanford versus relying on your EMR vendor or a third-party vendor for those type of things?
So I will say that for interpreting our correspondence, we have a vendor that does lockbox services. So that is continuing to get built out with that particular vendor. I think at some point the question is, where can it really live? If it all can be in an EHR, gosh, that would be great. We just need to recognize that it can't be everything, right? And so being able to pick your different areas and say, these are all images, and computer vision solutions may be more effective, and there's a more robust model that already exists, sort of instead of retraining it using that. We do have some of our own internal pieces. So I mentioned the physician inbox piece. We're going to be leveraging that same thing, and that's kind of our expectation, is to leverage that same technology that has been developed internally for our patient billing messages. That said, we also have an omni-channel vendor that's helping us pull all that stuff together. So we don't have an exact answer on that. I would love for us to be able to implement much of this within our own four walls and in partnering with Epic. But really it comes down to what solutions are out there now, and we may be implementing that today, and it may change in the future. So we are just starting this journey with, I think, like many others that are, and we're working to identify our various vendors that can help us partner with that. And in some cases, those vendors, they already exist, and they're layering in AI, Gen AI, to solve their business problems at scale, that essentially already had some solutions that vendor was helping provide, and just expand on that. So it's going to be heterogeneous, just like all of healthcare systems at this, or health systems and the systems that support that are. And so we're continuing to evaluate that. That's the important part of that governance, is that as we start to see overlap, is to say, okay, which one should we pick, and how do we build that model when we pick just say one particular vendor for something where there's overlap. I hope that answered that question.
Yeah, that makes a ton of sense. The next question is also directed to Noel. You earlier on in the webinar, you mentioned adding ChatGPT to your network. This question is, how does staff access it? And how is it HIPAA compliant?
So it is essentially it's the ChatGPT framework that's within our own system. So we've implemented it's accessed through our intranet. So you have to be on the intranet to be able to access it. And you're actually selecting which GPT model you want to use, and then it will start that process of loading up that particular GPT, that particular Gen AI model. And then that's all kind of contained in our health system within our network. And the models are not necessarily shared out, which is what's really important, is that that's also how to make it HIPAA compliant, so that potential patient data or account data or those sorts of things are not leaked.
Right, got it. And then the next question that is in the chat is, Gen AI can respond and feel like a human is interacting with you. Are you using Gen AI to respond to patients or to triage the patient inquiries with prompts for clinicians to review, edit, or respond? And if it is directly replying to the patient, are you exposing that patient to the fact that they are interacting with Gen AI and not actually interacting with a real human?
We are not having it be, we're not having direct human interaction. So say like chatbots and those sorts of things, we don't have that at Stanford right now. So it's all being done with a human in the loop. And so it is a human element. And so a human is interacting, and in some cases they may be editing that response. The large language model likely will be also learning from that response for that particular physician to say, oh, they use these words more frequently. That actually can get that precise. I'm not completely sure about how that's being done for our inbox messages right now, but I imagine that that's something that will happen. So we are not having to communicate to a patient that they're interacting with a bot versus a human. And I guess I would kind of pivot that to, what do you experience now? I mean, I know that I went on a website to ask for support, and I asked for a support agent. And that support agent, I know for a fact, was still ChatGPT, because it took a number of requests and it was giving me kind of generic information until I finally was able to get to the right question that then actually had a real human on the line. And then it said, oh, you're now communicating with a actual support engineer agent. Like, oh, okay, well, they didn't really tell me that, but we all kind of know that. I think there needs to be some guidelines that are developed around that, and maybe possibly even some potentially regulation may happen. I don't know. There's a lot of discussion about what we need to do to regulate the ChatGPT and Gen AI uses. So I think that's still an opportunity area that needs to get built out. But right now we are continuing to have our humans be directly in the loop, because it also helps our humans trust the system. They can trust and verify.
Right. Yeah, especially that example that you gave is definitely a common experience, honestly, not just in healthcare, but just in general these days, kind of throughout all industries.
Yeah.
The next question goes to both of you. What is the accuracy of the answers to the end user prompts, and is it giving you complete answers, or is it kind of sporadic? What is your experiences with those kind of things?
Yeah, I'm happy to go first, Noel, on this one. Yeah, I think for us, I'll speak from kind of the solutions we've developed and how we're using generative AI. And so, as we talked about before, ultimately the goal is to deliver the answer. But as part of that, obviously, it can be helpful to provide in this symbiotic relationship of a specialist and the generative AI, tool some indications around both the confidence of the generative AI tool in that particular recommendation, as well as supporting evidence. And so we found that it's important to provide some kind of a visual indicator of the overall confidence, because these are, at the end of the day, mathematical models behind the scenes. They do have a sense for how confident they are in a particular recommendation or suggestion. And then in addition to providing kind of that background, so that very human readable description for the justification behind that particular recommendation, as well as the direct evidence that supports that particular output. So I think all those things paired together, we've seen perform pretty well, and working with staff and users and specialists to provide that kind of confidence and that indicator on the actual output or suggestion.
And for Stanford, we are just starting the process of implementing Gen AI into our revenue cycle. So drafting denial letters based on clinical data is something that we're in the process of evaluating and defining what that scope is. Where we've used Gen AI so far has been on the physician side and the clinician responses. And there has been a very high level of confidence in the responses, and that's really reduced the amount of burden on our physicians. So we're in that process. There is some tools that we're doing that we'll have that we're implementing now. We're in the process of getting those into our governance program and actually activating the helper tools that will allow for being able to read information from medical charts and being able to summarize those for questions that may be asked in an authorization request where we need to fill out that information. And so that's where we're going to start really looking at Gen AI, and we will really need to evaluate how accurate those are. I think the interesting thing about that is, in many cases, folks that are doing authorizations are not clinicians. They're really just trying to get the summary data, and they're picking things now that they may be selecting a whole bunch that may not be relevant. And now this will help really target that, but we'll monitor that very closely.
Thank you both for your input on that. I know we're a minute or two past the hour, so I just want to thank Noel and Corey again for an excellent discussion today, and also to AKASA for sponsoring today's webinar. Thank you again for joining us today, and we hope to see you all at future Becker's webinars.
Thanks
so much, all.
Thanks, Corey.
Thanks,
Noel.
Cameron. Great job.